you everyone again for joining us today for our webinar. Our webinar today will focus on how to use behavioral sciences for better knowledge management, or KM. And it looks like we have a lot of familiar faces and some new ones as well from all over the world. So welcome everybody. We're so glad that you made the time to join us today. We know everyone's schedules are very busy. Just a couple of housekeeping issues. I'm sure if you've attended Knowledge Success webinars in the past, you're familiar with this, but for anybody who's new to us, we did want to mention that we do have French interpretation available. And so if you'd like to listen in French, please click on the interpretation icon at the bottom of your Zoom screen and then click on French. And you'll also have the option to mute the original audio in English so you don't hear that in the background. And as a reminder too, we will be speaking slowly and pausing before we transition to the next slide to give our interpreters a chance to catch up. We also have closed captioning available. You should already be seeing the captions automatically, but if not, and if you'd like to see them, you can select them by clicking on the icon with the 2 C's at the bottom of the Zoom screen. And if you wish to hide the captions later, you can select the same icon and then select Hide Subtitle from the menu that appears. These captions are generated automatically by Zoom, so they're not 100% accurate, and they are only available in English at this time. So my name is Ruwaida Salem. I'm a Senior Program Officer at the Johns Hopkins Center for Communication Programs, or CCP. And I'm also the Knowledge Solutions Team Lead for the Knowledge Success Project. And at the project, I oversee and support a number of different knowledge management products and activities for the global family planning and reproductive health community, including FP Insight, learning circles, and the pitch. Joined today with 2 of my colleagues. Neela Saldana is the Executive Director at the Yale Research Initiative on Innovation and Scale at Yale University. So her mission is to develop the science of scaling interventions for development. Neela has deep expertise in the behavioral sciences field and has applied those skills in both the social and private sectors. And interestingly, Neela was mentioned in the Forbes magazine as one of the 10 behavioral scientists you should know. So we're really excited that Neela is with us today. We also have with us today my Knowledge Success colleague, Mariam Youssef. She's an associate with the Busara Center for Behavioral Economics, where she has supported and led the design and implementation of behavioral research and interventions for a range of projects, from social investment and financial inclusion to health and agricultural resilience, and of course, to knowledge management. Before we take a look at our agenda for today, I did want to say a few words about the Knowledge Success Project and about knowledge management for those who may not be as familiar with us. So our project is funded by the U.S. Agency for International Development, or USAID, and it focuses on knowledge management for the family planning and reproductive health community, or for programs. So what exactly is knowledge management? We often get questions about that. So we define it as a systematic process that involves both collecting knowledge and curating knowledge. And importantly, it also involves connecting people to that knowledge and to each other so that they can act effectively and efficiently. And what we like to tell people is that you probably all are practicing knowledge management to a certain extent, but perhaps you're calling it by different names. So a lot of times, for example, when you're synthesizing a body of evidence and developing guidelines for healthcare delivery, that process and that those activities are knowledge management. When a provider uses those guidelines then to inform their healthcare service delivery, that also is knowledge management. So all of those things involve collecting knowledge, curating it and presenting it in ways that are easy to digest and apply and then connecting people to that knowledge so they can inform their work. Our goal at the Knowledge Success Project is to make it relevant, easy, attractive, and timely for family planning and reproductive health professionals to find and share the information they need. So a key aspect of our project is to take a new approach to knowledge management that infuses behavioral science principles in order to make knowledge exchange and learning for the FPRH workforce relevant, easy, and timely, so that they can deliver better results in their programs. And the reason why we're here today is to share with you more information about what behavioral science is, and also to share some behavioral science frameworks that can help us better understand knowledge management behaviors, and also to design knowledge management solutions that are relevant and useful for people. As we share these frameworks, we'll also demonstrate how you can apply these frameworks to knowledge management through a case study from the Knowledge Success Project. And we want this webinar to be as interactive as possible. So we do have a few polls sprinkled throughout the presentation for you to respond to. And as always, we always leave time for Q&A at the end of the webinar to respond to your questions. Please feel free to put your questions in the chat throughout the presentation, and we will address them at the end of the webinar. With that, we'll actually start with our first poll. So our first poll to you is, what comes to mind when you think of behavioral science? And if you can put in the chat 1 to 2 words of the first words that come to mind when you hear behavioral science. I see some things coming in the chat already. Great. I see human beings and practice, evidence, adaptability, habits. Now we are testing out something today, a new tool called Stream Alive, which takes all of these answers in the chat and displays it visually. So I'm going to ask Emily if she can show the Stream Alive screen now so we can get a sense of what people responded. There you go. Great. So this is the answers. I see habits come up a lot, the study of behavior, how people act, adaptability, change. So all great concepts here. So this is just a quick way for us to get a pulse and see what people are thinking as they come into this webinar. And see, study of behavior is coming out pretty strong there. Wonderful. So at this point, I'd like to pass it to my colleague, Mariam.
Thank you, Ruwaida, and hello, everyone, and welcome. Glad to see everyone sharing their ideas of what they think behavioral science is. Some very interesting thoughts coming through. So what we'll do now is just touch a little bit more on what behavioral science is, and just unpack some of the key principles of behavioral science that inform how we think and how we behave. And then I'll hand it over to my colleague Neela, who's going to expand on some practical ways that we can apply behavioral science. So we're going to start off with a very interesting activity. I think this will help set the tone for how we explain and define behavioral science. So this activity requires us to say a couple of words out loud. So in a few seconds, we're going to display some words on the screen, and we would like everyone, while muted, just to shout out loud the words that they see on the screen. So just to yourselves, immediately you see the screen come up, just shout out loud the words that you see. and then we'll go into the next task. So Emily, when you're ready, just go to the next slide. Okay, I think we're done. Okay, perfect. So I think we can proceed to the next activity. So for this next part of the exercise, we're going to do something slightly different. So instead of shouting out the words, you're going to shout out the color of the words. So we're going to show another set of words on the screen, and we'd like everyone, while muted, just to quickly shout out loud the colors of the words that they see. Okay, so we had a chance to do that. So I think we can see that naming the colors is much harder than reading out the words out loud. It's a bit conflicting because you're trying to say the word, but then you also want to say the color. And this is an interesting task that really shows us the duality of our thinking. And this particular task shows us that because we're so used to saying out the words, when we're asked to say out the colors, it's almost instinctual to say out the words. And this task is called a Stroop task. And the Stroop task just basically explains how our habits inform our behavior and our decision-making. Because we're so used to saying words rather than reading out or saying out loud the colors of the words, our instinctive response is, for some of us, may have been to say blue or black instead of the actual color of the word. So that's an interesting way just to demonstrate how our minds work and how sometimes our minds go against the instructions or go against the rationale thinking that we hope we can have. Okay, so just to explain this a little bit further, so our minds have two systems of thinking. And I think this is probably one of the most important principles of behavioral science. And we just proved that with the Stroop task that we did. So when we were asked to say the color of the word, I'm sure some of you hesitated a little bit, and some of you may have said the word instead of the color, which is absolutely normal and is what most people do in that circumstance. And the duality of our thinking, or the two systems of thinking we have, are system one, which is a more of a fast, instinctive, habitual way of thinking. And then we have system two, which is a much slower, much more analytical way of thinking. So psychologists and behavioral scientists over the last couple of decades have come to this agreement that we have these two systems of thinking, and most of the time they're at odds. So if you think of system one as the way that we think about the world habitually. So system one is influenced by our habits. I saw that somebody wrote habits in the word cloud that we looked at. Practice, instinct. So system one typifies how we behave based on the habits that we formed, based on our emotions. System one is very emotive, and system one is also based on our instinctive responses and impressions. While system two is more methodical, more analytical. So examples of this could be brushing your teeth in the morning. You don't really think much about how to brush your teeth, when to brush your teeth. It's a habit that you've formed for many years. The same thing with, the kind of shampoo you use. Maybe you've formed a habit of the kind of shampoo that you like to use. So those kinds of decisions are very instinctive. Whereas, for example, picking car insurance or, deciding which neighborhood to live in is a much more important decision that requires a little bit more thought. So over the years, psychologists have kind of tried to exemplify these two systems of thinking. And this is kind of the bedrock of how we see and view behavioral science, understanding that because we have these two systems of thinking, our ways of making decisions or the process of making decisions is not always rational. So because we are torn between the very fast, impulsive, and habitual ways of making decisions and the more analytical and more methodical ways of making decisions, we don't always make the most rational decisions because system one is error prone. And because we usually rely on system one for most of the activities and most of the decision making we do. So if you think about your average day and the kind of decisions that you have to make each day, going to work, driving the car, making breakfast, brushing your teeth, you don't really spend a lot of time thinking too hard about making those decisions. Most of those decisions are made based on your habits and the practices that you've already formed. So because we tend to rely mostly on system one thinking, we can be error prone, meaning that we may not take into account all the information that is available, and we may be a bit biased in the way that we make decisions because we're relying on habits rather than relying on other pieces of information that can help us make more informed decisions. So bearing this in mind, we can move on to the next slide that helps to explain the process of behavioral science. Okay, so with this in mind, understanding that we have this two systems of thinking, system one, as we said again, very habitual, very instinctive, very emotive, and system two, much slower, much more analytical, we understand that we don't always make rational decisions. But more importantly, our decision-making is predictably irrational, meaning that since we understand that we rely mostly on system one, and system one is quite error-prone, we can kind of identify the habits and emotional responses that people tend to display in different circumstances and contexts. And with that, we can have an array of descriptive ways to understand how people are likely to behave. So the fact that our behavior is predictably irrational gives us the science, the science of understanding behavior. And we can see behavioral science as a systematic way to understanding how to arrive at behavior change. And that, simply put, is how we try to convey the understanding of behavioral science. So now that we've looked or talked a little bit about what we consider to be behavioral science, I think we can all agree that behavioral science really is the process of arriving at behavior change. And we can do this in many different ways. So we can consider behavior as the outcome, or behavior change as the outcome that we want to achieve, and the science as the process. So the systems, the methods that we use to arrive at behavior change. And there are many methods to this, but we mostly summarize them as observation, so observing how people behave and make decisions in their natural environments, and then experimentation, testing how people respond to different stimulus and how that changes across different contexts. But more importantly, now that we understand that the ultimate goal of behavioral science is behavior change, we can link that back to knowledge management. Knowledge management, in essence, is really understanding how we can improve knowledge management practices, and that in itself is a form of behavior change. So we can see that knowledge management is ultimately a form of behavior change, and behavioral science is a very important and critical part of achieving behavior change within knowledge management. But before we proceed to the next slide, it's important to know that as we discuss the different ways that we can apply behavioral science practically, it's also important to understand how to do it the right way. Not only how to do it the right way, but how to do it equitably. And I'm going to pass it on to my colleague, Neela, who's also going to explain some of the different methods and approaches we use in applying behavioral science. But towards the end, she's also going to explain how we can apply behavioral science in an ethical manner.
Hello, everyone. So I hope you got a sense of, how our minds really work. And this has been the advance in behavioral science. I just want to remind everyone, please put in your questions in the chat. Just make sure there's a question mark. As Ruwaida said, we're testing artificial intelligence bot tool, StreamAlive, and it will pick up your questions. So we will get to them at the end of this webinar. So now that we know, what behavior science, how our minds work, I'm sure the question we're all asking is, we're not here to be scientists, right? We're here to apply that work to our own knowledge management work. So the question is, well, how does this help us? And so there are two parts to this. The first, in order to effect behavior change, we have to understand what drives that behavior. What are the barriers? What are the facilitators to behavior? So understanding is the first part, diagnosing those barriers. And the second part to behavior change is then designing the right solutions that arrive at those barriers. So first, we're going to sort of present a simple framework to understand the behaviors or understand barriers to behavior change. So there are many frameworks. Every behavioral scientist has their own framework. We've looked at a number of them, and essentially it comes down to three main questions you need to ask in order to understand behavior. So the three questions, very simply put, are, do people want to do this behavior? Okay. The second question is, can they do this behavior, or can I do this behavior if it's a behavior change that you are undertaking? And the third question is, at the time of actually doing the behavior, is there something that's preventing me from doing this behavior? Okay, so three questions: motivation, do I want to? Ability, can I? And opportunity or action is, do I actually do the behavior? Now, although we've put this in a very linear format, I just want to say that it's not as linear as it seems. It's not that you have to have motivation first and ability second. In fact, one of the advances of behavior science is that sometimes when it's easy to do the behavior, my motivation to do that behavior increases. So it's almost like each of these feeds into the other factor. And so thank you for asking that question. But really, these three things is what you need to keep in mind. And what behavior science has actually been has actually added to our understanding of behaviors. We used to look only at motivation. We used to think if we give people information about the benefits of doing a behavior, and if they believe that, then they should carry out the behavior. What behavior science now tells us is it's not just motivation. It's the small little frictions in terms of can people actually do the behavior, and do they actually do the behavior at the point of action that might prevent people from actually undertaking the behavior. Okay. So let's briefly look at these. There's much more detail in the training decks. We don't have the time in a 1-hour webinar to go through each of these in detail, but let's at least just give you a sense of what these three buckets are. So the first thing you want to say with knowledge management is, does my audience want to actually implement this knowledge management system or share knowledge or update knowledge in any ways? And you want to ask questions such as, what is the goals of my audience? If the goal of your the person is to get the work done and get out very quickly because maybe they have to go pick up their children from school, then it is absolutely, it's not in your interest to have a webinar at 6 p.m. in the evening, right? So I think you have to first find out, what's the goal? Is the goal of my audience to look like they know something? Is the goal of my audience career advancement? They might want some certification. So it's really important to understand the goals of your audience. It's important to understand what their beliefs are about the knowledge management system. They might want to have career advancement, but they don't think this particular knowledge management system can actually help them reach their goals. They think that if I do a Google search, it's actually much better. So you really have to understand not just what their goals are, but also what their beliefs are about the system. Rewards are a great way, to get people motivated. We see that all the time. We say when I go and exercise, I'm going to reward myself with something. It really helps to motivate and set the habit for doing the behavior. And the reward doesn't have to be financial. It can be the reward of having my peer group acknowledge that I am the go-to person to find something, in the knowledge management systems. But without rewards, we find it very hard to do that behavior. we talked about system 1 and system 2. What's really important to understand is that motivation isn't just about people thinking, it's also about how people feel. Do they feel pride when someone tells them, oh, I don't know how you have so much knowledge about the knowledge management system? Or, do they feel, when they come to sharing failure, do they feel a sense of, do they feel terrible about sharing their failures? Do they feel unsafe to share failures? So we really need to understand the emotions that people use to find, to share, and to use knowledge. So that's the do I want to. When you're asking people to participate in a failure seminar so we can share failures, people have to have the goal that they want to get better. They have to have the belief that participating in such a seminar will actually help me and it won't hurt me. They have to have a reward at the end of it. I feel really good. My peers acknowledge that I was brave to do this. My manager acknowledges that this is a good thing to do. And it has to be accompanied by those emotions. And then people will say, yes, I actually want to participate in this failure seminar. But that's not enough. The two other things that people need to know. So people have to know how to do that. Okay, so if people say, I want to participate in this failure webinar or this failure conference, but they don't know how to. Okay, you sent them the link a month ago and now they can't find it in their email. Or they're not quite sure, is it real, is it virtual? Or they really don't know how to participate online. They're not going to do that. Right? Think of yourself going to the gym. If you do and you see you really want to exercise and then you go there and you see a machine that you absolutely don't know how to use. Is it for my arms? Is it for my legs? You're just not going to do it. So it's not important. It's not necessary that you want to do something. It's necessary that you know how to do that thing. And that could include something as simple as, I don't actually know how to log into this webinar. So you have to be really clear about tiny steps in terms of ability. So now we know that people, and again, I want to iterate, this is not linear. This is not first step and then second step. These are all the things that people need to do. So that's great. So people have motivation. They want to attend, say, your FailFest conference. They know how to. They've got the link. They know how to operate. They know how to get in. They know how to chat. They know all of that stuff. Do they actually do this behavior? And you'll be surprised, and this is the one thing behavior science shows, is that when it comes to the point of doing the behavior, many things can derail the behavior. We've seen this all the time. We have, 170 participants. I'm sure 300 registered. But at this moment, something happened, right? Either there was some time issue. People said, oh, I forgot I had this other deadline, so maybe I won't join the webinar at all. Or there's some other hassle factor. My internet connection is not reliable, so I'll just I'll just leave and get a recording. Or maybe there's just inertia, like I just forgot. It was, this is something new on a Tuesday and or a Wednesday, and I completely forgot about it. So just because I wanted to join this webinar, just because I know exactly how to do that, I got the link, I got the reminder, doesn't mean that I actually do it at the point of the action. So when you think about understanding behavior, just remember, think not just about motivation, giving people information, but think about how do people do this behavior? What's the ability? And at the time of doing the behavior, is there some hassle factor or their own procrastination, inertia, normal human things that will prevent them from doing the behavior? So I'll turn it over to Rueda now for a case study in how we use these factors to actually understand what was preventing people from performing this behavior. So over to you, Rueda.
Thank you. Thank you, Neela. Thanks so much for explaining that in a very thoughtful way. So the case study that we wanted to share with you is on FP Insight. It's one of the knowledge management solutions that the Knowledge Success Project manages and hosts. On the next slide, before I talk a little bit about how we use motivation, ability, opportunity framework, I wanted to just share a little bit about what FP Insight is. Maybe some of you already know what FP Insight is. I hope some of you are already members. I imagine it's probably new to at least some of the participants online. So FP Insight is a knowledge management tool. It was designed specifically for family planning and reproductive health professionals, and it was actually designed with them through co-creation workshops. The platform takes inspiration from popular social media platforms to make it fun and easy to find and discover new information, to share that information, and to organize it into collections that make sense for individuals' own work. So the individual users are the ones in the driver's seat with FP Insight. They're the ones who post the information resources to the platform. As they're posting this content and organizing it into collections for their own work, for them to come back to whenever they need them, they're also sharing it with the other FP Insight members. And so others can see what they're posting to get inspiration from what they are using in their work. So while it's a tool for individual users, everyone is also contributing collectively to a body of knowledge that benefits the whole family planning and reproductive health community. So what exactly does this have to do with the motivation, ability, and opportunity framework? Well, we launched FP Insight in June of 2021. And about 1 year later, we surveyed our FP Insight users. We had about 700 plus FP Insight users at that time. And we wanted to get their thoughts on the platform after having used it for several months. So what we decided is that we would use that motivation, ability, and opportunity framework to design our survey of our users. And one of the main things we wanted to better understand is how to encourage our users to continue being actively engaged on the platform. So that means that we wanted to know how to motivate them to log on to the platform regularly, and most importantly, that they post content to continue contributing to the evidence base for the family planning community. And this is especially important because FP Insight is, based on individual users posting content. So we need to make sure that it's useful and relevant for people. It's easy to use so that it can benefit them and the entire community. So in our survey, we asked a number of questions to better understand people's motivation, ability, and opportunities. So for example, we asked them to rate on a 5-point scale statements like, I believe FP Insight is a useful tool for organizing the FPRH resources I use in my work. And this was to help understand whether they were motivated to use FP Insight. For ability, we asked if they felt confident using FP Insight and whether they felt they needed the support of a tech person to use FP Insight, or if, that it was relatively easy to use. For opportunity, we really wanted to understand if there were any environmental constraints that were getting in the way of them using FP Insight. So we looked at things like if they had time at work to devote to knowledge management behaviors, and also about their internet connectivity. We also asked people specifically if they had posted content on FP Insight, and if they didn't, whether it was because they didn't know how to, or their ability, whether they didn't have time to, for under opportunity, or if they perhaps didn't want their posts to be public, so related to motivation. And before I share what we learned from the survey, I wanted to take a poll, another poll here of you all. On the next slide, you'll see our poll question. So what of these 3 factors, motivation, ability, and opportunity, what do you think was the biggest challenge for engagement on FP Insight? And I'm going to ask Emily to share the Stream Alive window here. And you can feel free to put in the chat your answers. And you can either type in the number 1, 2, or 3, or type in motivation, ability, or opportunity to see what you think the biggest challenge. And it looks like so far, it's like, motivation, opportunity, it's going back and forth. Looks like the biggest one so far seems to be opportunity. It keeps going back to motivation with a smaller percentage saying ability. Great. Thank you for weighing in on that. So it looks like most people now are, just as I'm about to say, it looks like most people are saying opportunity. It switches to motivation. So great. So I think it's obvious that people are waffling between motivation and opportunity. And so Emily, if you can go back to our slides, I will share what the actual survey findings found. Great. So from the survey, we actually found that FP Insight users are highly motivated to engage with the platform. They believe that FP Insight is a tool that will benefit them and their colleagues. In terms of ability, we did find that about 1/4 of the respondents said that they didn't know how to post the resources. So from that, we realized that there was still some more work that we needed to do on that front to make sure that people have the capacity and skills to use FP Insight's features. The most significant barrier, though, that we found was lack of time. So it was opportunity. When we asked participants to rate their agreement with the statement, "I have time at work to find and share information to inform my programs," you'll see here on the displayed on this slide is the results from the English language respondents. So only a little more than 1/4 rated it a 5, meaning that they agreed fully with the statement. On average, people rated the statement a 3. So kind of like neutral. Some people, about 1/4, rated it as a 2, meaning they really didn't agree with the statement. So for us, what we found from the survey maybe wasn't late breaking news. Like we know that people have a lack of time. I think we all understand that there is so much for us to do in a given day, and we all wish that sometimes that there was just a few extra hours in the day for us to complete our to-dos and to go, a little bit above and beyond and do some extra things like, looking for new information to inform our programs. But what this motivation, ability, opportunity framing helped us to do was to really shine a light on what the key barriers to engagement on FP Insight were. Because what we found is that sometimes, even though we kind of understand what some of these barriers are, we don't really pay attention to the significant ones and systematically design for them. So I'm going to pass it to Mariam now to share information on how we can design KM solutions that take into account these types of barriers.
Thank you, Ruwaida. Okay, so as Ruwaida has said, we have looked at the diagnostic tool or the process by which we can identify the kind of challenges or barriers to demonstrating the behavior that we want to see within knowledge management. And now we're going to look at some of the ways that we can ideate and design solutions to address some of these barriers and challenges. Lovely. So one of the most popular ways in which people are applying behavioral science to design and create solutions that address some of the problems around motivation, ability, and opportunity is through the EAST framework. And the EAST framework outlines a very simple 4-step process that anyone can apply within any sector to address and develop solutions that target their key audiences and help improve or drive behavior change for the key behaviors or key outcomes that they want to see. And the EAST framework, most of you might be familiar with the EAST framework, but the EAST framework was actually developed by the Behavioral Insights team. And the Behavioral Insights team started off as a consultancy or advisory group based within the Cabinet Office of the United Kingdom advising the British government on how best to improve policies around taxation, education, and healthcare. And eventually, with time, they became an independent organization that provides behavioral science consultancy across the globe. And they were the ones that coined this EAST framework. And we're going to go through the framework step by step and just look at some of the key components. But the EAST framework largely stands for making things easy, attractive, social, and timely. The first element of the EAST framework, which is arguably the most important, and that's why it stands out in this blue diamond, is making things easy. And as intuitive and simple as this sounds, it's very easy to get carried away in creating solutions for an audience that you're not in touch with. You know, as policy implementers, researchers, program implementers, we know the audiences that we're trying to design solutions for, but sometimes we need to put ourselves in their shoes and design from their perspective, and always reminding ourselves on how we can make our solutions as easy as possible. And some of the key things that we want to think about when we're trying to make solutions easy is really making it simple. And as straightforward as this may be, you will be amazed and blown away by how many times you start off with creating a simple solution only to end up with a very complex product or very complex service that you yourself don't even understand how you will navigate through it. So keeping in mind how to make things simple and accessible. So understanding what are the accessible channels through which you can deliver your solutions to your target audiences. We work across very complex, very diverse audiences. Some of them are not as digitally enabled as others. So understanding what solutions fit the different demographics that you're dealing with. And then leveraging defaults, which is also a good way of making things simple. We understand that trying to shift behavior or shift culture around a particular behavior can be quite difficult at first. So in trying to encourage people to engage, you want to make your solutions as default driven as possible, meaning that you enroll people automatically onto platforms, onto programs, and then give them the option to opt out. This has been a very successful tactic in the UK in improving the levels of pension enrollments. And this was a study done by the Behavioral Insights team where they discovered just automatically enrolling people into basic pension plans at their places of employment significantly improved the level of the citizenry that were on pension plans. Because most people, when you give them the option to opt out, most of them don't really take that option and they continue on with the products and services that you provide. And then they're able to discover and understand the benefits with time. And then if they choose to opt out, they can. Another element of making things easy is also removing hassle factors, as Neela mentioned as she was going through the MAO framework. And this really has to do with removing the inconvenience of dealing with a product or engaging with a solution. This spans across different things. We have the hassle factors of dealing with multiple options, the hassle factors of dealing with very time-consuming solutions. So trying to minimize the time constraints, trying to minimize the effort that people have to make to engage with your solution.
Mariam, I think we have only about 15 minutes and we want to keep time for Q&A. I just want to make a point that, you don't have to take down everything right now because we have much more detail in the training package on the EAST framework with examples and so on. So, as Mariam goes through it, you might want to think about going to the training package and also much more detail on the understanding behaviors, motivation, ability, opportunity framework. And we'll come to that about where we would find the training package. Ruida's going to cover that. So over to you, Maria, maybe about 5 minutes just to run through the framework.
Okay, thank you, Neela. So we can move on to the next slide. So making things attractive is really about appealing to your audience and trying to personalize the solutions that you're creating. And this could be through the messaging, the types of framing that you're using in delivering the solutions or marketing the solutions to your different audiences, and trying to make sure it is as engaging and appealing to those demographics as possible. Making things social, this relates to just leveraging of social norms and social proof, making people feel as though the behavior change or the desired behavior or the solution that you're trying to introduce is used by their peers. It's something that is acceptable, socially acceptable, and is also something that other people are benefiting from or is adding value to the lives of others that they consider to be peers. And finally, making solutions that save time. And Ruwaida has already talked about this. We found that time, or the opportunity component, was probably one of them, was the most influential or most important for some of the professionals that we surveyed. So with this, we're trying to minimize the time constraints, saving time for users, and also thinking about how we can target audiences at the right time. So we understand that there are pivotal times where people are more susceptible to change. We all understand when we set New Year's resolutions at the beginning of the year, we like to make changes or start new habits at the beginning of or the turning points. For example, the beginning of the year, beginning of a quarter, starting a new job, getting a new promotion or getting into a new job role. So trying to target people at these pivotal points in time and encourage behavior change at those times. So with that, I'll hand it over to Neela, who's going to go over some of the ethics around behavioral science.
Thank you, Mariam, and thank you for that efficient run through of the solutions. As always, I do want to stress there's much more detail, and you will find it in the training package. So don't worry if you didn't get all of this. So we talked about, behavior change, understanding behavior, the motivation, ability, opportunity framework, seeing how it was applied, and then designing solutions, making it easy, attractive, social, and timely, with easy probably being the most important and the easiest thing literally to do to convert behavior to action, which is why it's a different color. It's the one thing you need to focus on. I do want to make a quick point before Ruwaida gets into the solution, is about the ethics of conducting behavior change interventions. One thing that's really come up in behavior change, and maybe we can get to the next slide. One thing that's really come up in behavior change has been this notion that we're changing other people's behaviors. When is it ethical to do that, and how do we do it in a way that is actually ethical? Again, we have more on this and more to come, but just to give you a sense of some things that we maybe should be actually thinking of when we're running behavior change interventions. Next slide. So, there are a few things we need to, ethics came up as a big issue because a social media platform that I won't name, but everyone uses, had some researchers run an experiment that give people, negative content in order to see their emotional responses. And they found they had some interesting findings, but the main point is you can't trigger negative emotions in people. It's not ethical to do that, especially when people don't know they're part of an experiment. So there was a lot of outcry about this. And the reason I'm just bringing this up is to say we ought to be very careful when we're running behavioral science experiments. We talked about system 1 and system 2, to make sure that we're not manipulating people and we're not tricking people. So that's something to keep in mind. Next slide. And really, there's a framework around this that I would urge everyone to go through. We can put the link. It's the 4 Good framework, that when you're designing behavior science, policy or interventions, you've got to think about whether it's fair to everyone, whether it's transparent, people know it. Are you violating people's privacy? Give them a chance to opt out. What are the different goals of the person who's designing the intervention? I want you to get something versus what you're doing. Have people's opinions been taken into account? Have I heard people and what they say? What options do people have, to opt out of the intervention I'm designing or the thing that I'm doing? And is everyone better off, or will there be conflicts of interest? This is particularly important when there's a hierarchy and you're a manager who's trying to get the behavior of maybe people who report to you or other people who are lower down on the career hierarchy to do something. It's important not to abuse that power. So I think something for us to be thinking about, and Rueda's just put in the link in the chat about the Nudge for Good ethical. The reason we put it out there is it's as important as the behavior change frameworks and the behavior change interventions that we do, thinking about the ethics. So now I will turn it over, I think, to Rueda.
Great, thanks, Neela. And I'll just run really quickly through the FP Insight case study to show how we can apply the EAST framework to a knowledge management solution like FP Insight. So on the next slide, if we think about the survey findings about motivation, ability, and opportunity, and then use those findings to apply them to this EAST framework. When we think about EASY, we realized that we drew inspiration from popular social media platforms like Pinterest and Twitter and Facebook to design FP Insight and make it easy to use. We also actually hosted training sessions to bring people up to speed on what FP Insight is and how to use it. But we realized that we could make our trainings a little bit more interactive, so people are actually practicing how to post resources in the training itself, and therefore then help to make it easy to use the platform. We felt like we were doing pretty good on attractive because we used good web design and usability best practices when developing the platform. And in regards to social, we are now focusing on encouraging communities of practice and working groups to use FP Insight as a knowledge management tool with their members to encourage more use of the platform. And the key thing here is the timely aspect, since lack of time was one of the key barriers to engagement on FP Insight. So we are highlighting FP Insight as a time-saving tool because it does free up people's time that they would otherwise spend trying to find resources. We'll also be highlighting some of the mobile-friendly features on FP Insight, which allows them to use it as a tool while they're on the go in the field. They can download FP Insight to the home screen of their mobile device and use it as an app, for example. With that, we're going to skip really quickly. There's been some questions about the knowledge management training package, where you can find all of these slides or most of these slides and a lot more other information, a lot more details about behavioral sciences and how to apply it to KM. And you can find the training package on kmtraining.org. It is free to use. The key audiences for the KM training site on the next slide. We developed it mostly for KM trainers and global health program managers who are tasked with bringing new approaches to their staff members to help improve their programs. So these audiences can use the training materials to deliver a KM training workshop or adapt them to their own purposes. A secondary audience is really any global health professional, even if you don't intend on implementing a KM workshop yourself. You can learn about KM and on your own by going through the slide decks. You can also find practical tools to help you apply knowledge management in your programs. And on the next slide, we have, in terms of what's included in the training package, we have slide decks, we have exercises to help put the theory into action, and we have plenty of samples and templates. And we include, on the next slide, training modules on many different topics. So this is a sample of the homepage where you can find training packages, training modules from the basics, an introduction to what KM is, and some more details around behavioral sciences. We also have a module on integrating equity into knowledge management. And then we have some more specialized modules like on specific KM tools and techniques like peer assist and knowledge cafes. So with that, we only have a few minutes left, unfortunately, but I did want to see if we can answer some of the questions that have been in the chat. And I know Neela and others have been answering some of the questions as they came up. Neela?
So Yes, so Emily, can I ask you to turn to the Streamer Live and see what questions we've picked up over the chat? The quick questions. Okay. Yes, this is being recorded. It will be available later. Can motivation, opportunity, and ability be linear? I think we answer that. It's a good question. No, it should not and is not linear, but all those three need to work together for behavior to happen. Is it possible to have both systems? Absolutely. The one thinking in behavior science is that you need both system 1 and system 2. It's not an either or. Every time we do something, even if we are looking at information to make a really important decision, we're using both systems. And that is the key to behavior science. So don't just think about is the system 1 or system 2. Every decision, including using knowledge management in both. Rueda talked about the in-depth training program. We do have that, and you can find the whole package system there. Long-term learning can inform behavior and system 1 thinking. Absolutely not irrational. Long-term learning does help with creating habits, new habits. And so habits are another element of system 1 training. So absolutely, it's not irrational at all, and we can change it, but it's very difficult to change habits, as you saw with the Stroop task. What about the quality or effective or useful the system is? So that's part of people's beliefs about whether they should use a knowledge management system or not. Do people believe that it is useful? So wanting to use a system, I should first of all believe that it meets some of my goals. And I shouldn't just believe it's useful in general. I should believe that it's useful to meet my goals. So goals and beliefs about the usefulness go side by side in motivation. So it is a part of motivation. Friction between the elements, yes, absolutely. Sometimes, I really want to do something, but it's very effortful to do. Higher the motivation, obviously, higher the effort I will put in to solve some of the ability constraints. But sometimes if it's too hard to do, my motivation will get reduced. So there is friction between these elements, and that overrides, that helps with behavior or hinders behavior change. Should I target system 1 or 2? The main thing we want you to take away from this is that you need to target both. Okay, even when you're thinking about the way that you're presenting information, or giving people information, you need to say, what's my system 1? How can I make this easy for people to understand? How do I make it vivid? How do I make it attractive when I'm doing that? And you want to target both. There's no such thing as I'm only going to target system 1 or 2. Yes, you'll get the slides after the training package, recording. I think we got that. It's not the EAST framework. I answered this is not a decision tool, and I know we're out of time, but I'll just take a minute to see if there are any other ones. It's a way to design better solutions. EASY's colored blue, I think we answered that. It's really important. It is free access, direct link. So a lot of questions on the link to the package, which we'll send out. Thank you for your comment on the webinar. Do we have any others? Going down, Emily. Okay, so we hope that we answered your questions, and these are useful for us to put in an FAQs, frequently asked questions, later on in the training package. And we hope you enjoyed the webinar. Over to you, Rueda.
Great. Yeah, just to say that we're sorry we ran out of time, but we will definitely take a look through all these questions and provide written responses along with a recording of the webinar. And we will definitely send that out in the next couple of days. So thank you everyone for attending. We really appreciate your time and effort, and we're glad you enjoyed the webinar. It seems like a lot of people have really benefited from this. So thank you so much. Have a good rest of your day. Take care.
Thank you.